Congratulations! You just found out you're pregnant. You may be among the 60 to 90% of pregnant women who will spend the next 6 to 8 weeks feeling nauseous and throwing up. These women are suffering from nausea gravidarum, or nausea and vomiting of pregnancy, sometimes called NVP. In other good news, using the term morning sickness to refer to NVP is misleading. Many people feel nauseous during the morning, afternoon, and evening. Symptoms of nausea and vomiting can be triggered by periods of not eating, strong smells, laying down too soon after you eat, thoughts of some foods, or being dehydrated. Although the specific causes of morning sickness remain a mystery, the leading theories for its cause include the increased level of the pregnancy hormone human chorionic gonadotropin, which is at its peak during the first trimester, the decrease in blood sugar levels experienced during pregnancy, and a potential protective role against potential toxins. You might wonder what's actually happening in the body during morning sickness. The digestive system is designed to move food down and away from the mouth. When an afferent signal triggers the need to vomit in the medulla of the brain, efferent signals are sent that put the normal mechanism into reverse. These signals go to the diaphragm and abdominal muscles to force the contents of the stomach up. Signals also trigger the relaxation of the esophageal sphincter to allow passage from the stomach back into the esophagus. And closing of the nasopharynx prevents vomit from entering the respiratory system. Fortunately, this suffering is not without cause. Women who suffer from morning sickness during pregnancy are less likely to miscarry. This may be because the usual period of morning sickness coincides with the peak of embryonic organogenesis. In the majority of cases, morning sickness does not pose a significant health risk. But if morning sickness persists or becomes extreme, you may be suffering from hyperemesis gravidarum. This is an extreme form of morning sickness characterized by persistent and excessive vomiting, unrelenting nausea, dehydration, and maternal weight loss or a failure to gain weight. If you experience any of these symptoms, contact your maternity healthcare provider since medical attention may be required. Some treatment options for morning sickness include getting plenty of rest, staying well hydrated, avoiding an empty stomach by consuming multiple small meals, and identifying and avoiding personal triggers. Many women find that eating plain crackers 20 minutes before getting out of bed is helpful. If none of these things work for you, you may want to consult your healthcare provider for a prescription for an anti-nausea or antiemetic medication. Even though NVP doesn't make you feel like the MVP, enduring it just might be the start of becoming a super mom.